today I'm going to show you how to do a self-massage if you have bilateral leg swelling. So this is when both of your legs are swollen. And this is really important because this is just going to simulate what we do in the clinic when I do the massage on you. If you're coming, 1, 2, or 3 times a week, it's great because you're getting the massage. But when you're at home on those off days, you want to be able to do something that's going to continue keeping that fluid moving, keeping it keep it from re-swelling. And if you don't have the compression pump, this is a really great way to just do the very similar to what I've been doing. So first we're going to start with that deep breathing. So hands on the stomach, because I want to be able to see that diaphragm moving. So remember, as you breathe in, your stomach should expand, and as you breathe out, your stomach should come in. Do about 5 deep breaths. And breathe out. And like I said, I do my hand on my stomach just so I can see it. So about 5 of those. Then you're going to go for your neck, because everything drains back into the neck. So we're going to be feeling for the lymph nodes in our neck area. These are the same lines that when your neck gets swollen, your throat gets swollen when you're sick and you can feel it swollen right there. That's what you're feeling for. So I like to cross my hands, feel for the jawbone and go right underneath it to the neck area. And these little semicircles. So you push back and then just down. Just like that. And do about 5 of those. And then you want to feel for this little space back here. So you're going to find your collarbone and go right behind it. There's a little fossa, just a little soft area. And you're going to put your fingers in and you're just going to do this little push down and push out, a little flicking motion. So about that. 5 times. And 5. So now I'm going to work on the lymph nodes. So the first one we're going to do is the one in our groin area. You can start on either leg because we're going to be working on both. So I'm going to just start on my left leg. So you can go right inside the thigh. You're just going to push down and then in towards your groin. About 5 times. Then you're going to switch to the other side. Now we're going to do the lymph nodes underneath our armpits or axillaries. So you're going to go right underneath the armpit, push down and up. And 5. And then you're going to just do this little drag from your hips, hip bones, up to the side of your armpit. So just like this. It's a very light drag. And then the other side. And then you want to do this little stomach rub. This just simulates the diaphragm and the deep system. So you're just going to rub all the way up from your hips to your rib cage. Okay, so after you do all that, you've cleared the abdomen, worked on that area, and then you want to move on to the leg massage, and that's what I'm going to show you next. So you want to start with the top of your leg first, and you can do this 2 ways. Either you can do a drag, or you just go to knee to hip, just up and down, just like that. Or you can do a little semicircles, and I'm doing this over my pants, of course, but you want it at home, skin on skin is better, so preferably in shorts or something. So you can do the drag, like I said, about 5 times, or you can do those little semicircles. So you're just going to push down and up towards your hip. And you're just going to work all the way up the leg. And that 5 times. So knee all the way to hip. And then you want to go to your outside of your leg. So I'm going to bring a leg up, and you can do the same thing. You can do just a drag like this, or you can do a little semicircle. And go all the way up, really to the glute area. Just like that. So about 5 to 7 times. Good. So now we're going to go to the inside of the thigh. What you want to do is you want to push the fluid from the inside to the outside. So this time we are going to do a little drag. And so it's just like that. So push from inside to outside, starting at the top and then working down. You did about 5 times. Good. After you do that 5 times, you just want to do a quick drag over the side of the leg. About 5 times. And then now you want to get to the back of the thigh. So I'm going to prop my leg up, here to here. So start behind the knee. Same thing. You can do the drag 5 times, or you can do the little circles. 5 times. Alright, so now we're ready to move on to the knee. So I'm crossing my legs, just make sure I can try and get it in the camera. But you can be doing this sitting, laying down. Probably it's best if your leg is not crossed. But I'm just doing it so you can see it. So we're going to work on all sides of the knee. So I do the top first. Kind of just little circles over the knee. Push it in and up towards yourself. And then on the sides of the knee, I do both at the same time. This one time you want to push towards the front and then up. So front, up. And then the back of the knee. So push to the side and then up, drag up towards you. Alright, so the knee's now cleared. And you can kind of do like a little quick drag to keep that flowing. Now we're going to go to the lower leg. So I'm starting at the ankle. I'm going to work up to the front of the knee. Same as we've been doing. You can do dragging 5 times, or you can do those little circles. And I'm going to bring my leg all the way up. And then you're going to do the back of the leg. So drags or circles, 5 of those. Yep. Okay, then after you do the leg, you're going to go to the ankle area. And so you want to do you can feel these bones on the sides, they're called your malleoli. So you want to feel for that, and you're going to do the front of it, the bottom of it, and behind it. Just little circles. And pulling up towards you. Then underneath it. And then behind it. And then you're going to do the top of your foot. So I'm going to pull my shoe off just a little bit. And you're going to go from the base of your foot to your ankle. And then you're just going to come all the way up. And then after that, you're just going to do a drag over the entire leg. So foot all the way to thigh, get the back. Just kind of drag it. And then you're just going to do that little light effleurage again. So little tickle on the leg, just like that. So this is if you just have one leg swollen. So now if your other leg is swollen as well, you would do the exact same thing for the other leg. You would do starting from working on the top of the thigh, the side of the thigh, the back, all the way down to the foot. Just repeat the exact same thing over. And that's how we do the side of the thigh, or the other bilateral legs.